Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
And I have to just tell our listeners that when I call a doctor's office, the first thing they say is, if this is an emergency, call 911. You know, and it's like, of course, we all know to call 911, but we really don't understand the aspects of what happens with 911 and when you call them, what happens. And so I was so excited to have Dr. CESAR CARRALERO, who is the emergency medicine director at Broward Health, Imperial Point. It's a big thing for me to say this morning because I'm very interested in emergency medicine, but I was talking to Dr. Carralero and I didn't know half the things he was telling me about emergency medicine. I thought, well, you just go in there and it's any doctor who's in there. That's not true, is it, Dr. Carralero?
No, it's not.
Okay, so tell us when we call 911, what happens?
When you call 911, you'll get a hold of a dispatch operator who will get a truck to your house, and hopefully they'll arrive within about 5 or 6 minutes of your call, and transport you to the hospital. Depending on your condition, how emergent it is, they could take you to, they have a choice of facilities.
I was just going to ask you, so that they take you to the closest hospital?
If you have a certain condition, some hospitals are stroke centers, some hospitals are STEMI centers.
So what?
STEMIs, heart attack centers, sorry.
Oh, okay.
So EMS has a list, like an Excel spreadsheet, which check marks. If I have a heart attack patient, my closest facility is that one. So they'll go to that place. Or if you have a stroke, they'll go to the nearest stroke center that they choose to go to.
Okay, so now let's say somebody chooses Imperial Point. Tell us what happens. Do they call ahead?
EMS will call when you're en route, and they'll give us a quick report on the patient and tell us what's coming in. They'll tell us your vitals, and then you'll get there and we'll assign you a bed.
Okay. Now, you know, that seems so simple, but that person is very frightened. You know that when they're...
I know that.
And so, talk about the people, the EMS people. Now, you must have a great relationship with them.
We have a very close relationship with them. We deal with each other on a daily basis. I'm very close with a lot of the departments that serve us. For us, it's Pompano Beach, Fort Lauderdale, Oakland Park. Those are the main departments that come to us, and we have a very close working relationship. In terms of feedback, we try to give them information on the patients that they bring us, what happens to them. You know, for them it's very important because they only get a small piece of the patient. They pick them up at home and they bring them to the hospital. They don't know what happened to that patient. So we try to provide them with a lot of feedback. A lot of it is educational.
So let's go back then to you, and as a specialist, you could have, as a medical doctor, when you were doing your internship, you could have been anything. Why did you choose emergency medicine?
For me personally, I kind of ruled things out. I didn't want to have an office. That was one of them. I wanted to be able to go to different places, and I just fell in love with an emergency medicine rotation that I had. It was a rural rotation in Immokalee, Florida, and I fell in love with the guy that ran that rotation, and I just thought it was really fun to do that.
Well, when you think about emergency medicine, you have to really be pretty much of a diagnostician, I think, because you're going to get people, as you said, from with every pain and everything besides these shotgun wounds and things like that. But let's say a general person with stomach pain, and what is it?
Correct. You have to be willing and able to treat every age group. Every strata of society comes to the emergency room, and you have to be able to take care of them in an unbiased manner.
Right, and of course, for those of you who are listening to the show, if you haven't been to Imperial Point, Broward Health, it's a great place. People are very, it's not the largest of all the Broward Health facilities, but I have to tell you, maybe that's why it's so caring. Even maintenance people say, hello, good morning. That was a big training that happens. And I met your new director, of course, and he's very determined to make it the best hospital in Broward County.
Mm-hmm.
But But you, as an emergency medicine, I call it a practitioner, you're the director. How many other doctors are there?
We have about 7 full-time doctors, and we have another 4 or 5 part-time doctors. And we have a series of PAs and nurse practitioners that also take care of patients in the ER. So it's a team effort.
So are these hospitalists the people that you employ? The people who work at emergency medicine?
They are independent contractors. They contract with Broward Health.
I see.
Through another company called Envision, which is a very large healthcare company.
Now, are these people all have the same specialty as you?
All Broward Health emergency physicians have to be board certified emergency physicians. So that means they all received emergency medicine residency training, and they took their boards, part 1, 2, and 3 of their boards, and passed them.
And I would be curious to know what makes the difference in the training for someone who, let's say, is an orthopedic surgeon, and now they're emergency medicine. Could that plastic? No, let's say the orthopedic surgeon, he decides he wants now not to do that. He wants to get into emergency medicine. Does he have to now take a course to do that?
You have to, if you want to work at a place here in Fort Lauderdale, Broward Health, anywhere in Broward Health, you would have to go back to residency and retrain as an emergency medicine physician.
So when you think about that, it must be a lot of dedication to this. This isn't casual.
Right. Yeah, there's a lot of dedication. There's a lot. I mean, difference between orthopedic surgeons. I mean, I love orthopedic surgeons. I have great friends that are orthopedic surgeons, but they focus on different things. They're worried about bones and joints and ligaments, and we're worried about emergency medicine. Worries about emergencies. We're worried about what can hurt the person right now. Are they having a heart attack, a stroke? If they have a broken bone, do they have a compartment syndrome? Are their nerves functioning properly? Do they have proper motion after that fracture? So it's a lot of what can hurt them now.
And the one thing that, and I've only been in emergency room once or twice with something that wasn't, I guess, that serious, but then you have to make the determination if you're going to keep them in the hospital.
Correct. Yeah, it's that argument is, do they need to stay, or can they go home safely?
And they say, I don't want to stay in the hospital. I mean, of course, that's the big complaint, and the people there, he's not going to be in the hospital. And I guess you can't keep them there if they don't want, but they'd have to sign their life away and say, all right, we told you, if you go home, it's not smart, right?
Well, it's not signing your life away. It's just saying that they
could be signing your life away.
It could be. But they're saying they disagree with the decision to stay. And I understand what you're telling me. I understand the risks, but I want to go home anyways. And I always tell my patients, it's never personal. If you don't think that you need to stay, and I think you need to stay, then we can disagree. It's okay.
Yeah, right. But you're not doing this casually. There's apparently some sort of cause and effect, and that's what you're doing.
Depending on the condition that they have. If they have something that could be life or limb threatening to them, if they go home, I usually can talk them into staying.
Right.
Yeah.
And
so, people are reasonable.
And you get that you probably have a psychology degree on the side.
On the side, yes.
On the side, right?
Yeah.
All right. Well, let's just go back a minute to someone coming in on, from 911. We know that there have been great emergencies where there's a shooting, and there are a lot of people from the airport. I know that recently we had something big where there were 12, a lot of people. How do you prepare for that?
We do drills. We perform drills. We will have mass casualty drills where some we do that are planned, some we do that are not planned. And so we will get, we put our plans into effect, and we'll bring in actors, with bandages and fake blood, and in order to test our systems to make sure that we can deliver the care when we have to.
Oh, that's great. I didn't know that, but that makes sense. So my guest is Dr. CESAR Carralero, who is the director of the emergency medicine over there at Broward Health, Imperial Point. And if you want more information, you can always go, of course, to browardhealth.org, and then you can put in Imperial Point. But something that you did say, so let's say that I'm visiting someone up in Palm Beach County, but my home base is in Broward by your hospital, and all of a sudden I have a 911. Can I request that they take me down to Broward Health, Imperial Point?
The EMS services will have a limit. You know, if you're between two hospitals, you can definitely, if it's not an emergency condition, you can request to be taken between two nearby hospitals. But if you're crossing county lines, some of their units are not allowed to do that.
Ah, so be careful where you get sick, right?
Right.
The other thing that always amazes me, a lot of people decide to drive the person in their own car. You know about that. Why don't you talk to our listening audience about that?
That's not a good idea, because if something happens en route, you don't have the capacity to deal with the problem. You know, something as simple as an asthma attack, if it's too severe and you're on the way to the hospital, if something goes wrong along the way, you can always call 911, but it's harder for them to find you. So it's always better if it's a true emergency, you're very short of breath, you're having chest pain, numbness, weakness, difficulty with speech, any signs of a stroke, it's always better to dial 911.
Because there's something that every human being says, I don't want to be on 911. I don't want people to look at me. You know, we know what that is.
Yeah.
So what could you tell people? I mean, you just said that, but I guess it could be life or death.
It is life or death. In a lot of situations, it is life or death. You know, chest pain, shortness of breath, severe abdominal back pain. That is a life or death situation.
Well, there are a lot of people that go to emergency rooms, but they don't come but by 911. And that's always the big deal. How long do they have to sit there and wait? Talk about that.
For us at Imperial Point, we have made it our mission to get people through the system as efficiently as possible.
Okay.
So, on average, we can get our patients to a bed within about 11 minutes of arrival.
No kidding.
Yeah. In the winter, it takes a few more minutes because we're busier, but it'll go up to 13 minutes. Usually the doc is at the bedside by 3 minutes, so within 16 minutes of them hitting the door, we will have somebody at the bedside evaluating them.
And as a gerontologist, I was always very excited to know that Imperial Point has a special senior area. Talk about that.
Well, first of all of our private rooms, with the exception of one, so we have 19 rooms, all of them are private rooms. So you will be in a room by yourself. 5 of those private rooms are senior-friendly private rooms.
And what does that mean?
They means that they don't have an ER gurney. They have an actual hospital bed that's much more comfortable. They have a large recliner at the side for the family, big clock on the wall, bigger TV than the regular rooms, and then they have a large panoramic curtain in case we need some privacy. It's like it's a picture of a Hawaiian island or a picture of a park.
And the music, right? Hawaii, and you have hula dancers coming in.
That's a great idea.
Oh my, that's very interesting. Now, are any of the other Broward Health hospitals, do they have senior rooms?
I don't think so. I don't think not yet, no.
That's a very interesting idea to do that, and I don't think that we publicize that enough. And I'm glad that you talked about that, because that will allay the fears of so many of the seniors. The one thing that I've always said is that you need to bring someone with you. Mm-hmm. You absolutely shouldn't do this yourself if you can avoid that.
Correct. You should bring someone with you. You should also have a list of your medications, a list of your doctors is very, very helpful. We can get you a copy. I had it on me, but on the way here I misplaced it, and it's just a format in which you could write down your medical information. Merlea has it, and we can get it to you.
Well, let me tell you what I just recently did. Someone showed me this, and I loved it. I now have my photograph on my iPhone of all my medications and all my supplements.
Perfect.
Because I couldn't possibly remember everything. I don't take a lot of medicine, but I take a lot of supplements. And so someone hands you the phone and then you do it, right?
That's perfect. That's absolutely amazing.
I know. It's a new thing. I just did that 2 days ago, as a matter of fact. I thought that was perfect because I have everything stuffed into my wallet, and that's not so good. Okay, so that was the other thing. Well, let's just... let's go back over. So now you have to have someone that your physicians have to be pretty smart, because they have to see all the medications that this person's on. And then that requires some decisions.
It requires some decisions. It's very important. That's why I say to bring a copy of your prescriptions with you. It's very important that we document the medications that you're on, because it'll impact what we can give you in the hospital. And if you're going home, what we send you home on, we want to make sure that it doesn't interfere with the medications that you're already taking.
Yeah, that's so everybody, I hope that you're listening. Remember, this is Pencil Talk Radio. You're supposed to be making notes as we tell you. But I've never had anyone as specific. I've had other emergency medicine people. I've had them from Broward Health North, but never someone who is the director and has enlightened me on exactly what you're talking about. I did not know it was a real specialty.
It is.
And the reason I think I told you this before we started, that my very close friend, she's now dating a man who is an orthopedic, he was actually I think a heart surgeon. And he was away from his family too many times, so he decided to go into emergency medicine, and he loved it.
Yeah.
Because he wanted to be able to have strict hours.
Yeah.
And I guess that's something
it's a known schedule. You know your schedule for the whole month, and that's what you have.
Yeah.
And when you're off, you're off.
Yeah. But it also required somebody, as you said, to do some more, have more education, because I can understand why now, because a person even as excellent a heart surgeon he doesn't know a lot of the things. If someone has measles or they have another problem, right?
Medicine is very broad.
Right, and so that's what you did. So you must feel pretty good. So I'm going to take your personal phone number. If I have a problem, I'm going to call you. I'm kidding. No, I'm kidding. But I can see where people are really going to bother you. Probably when you go to parties and you tell them what you do, say, "Oh, well, I had this problem." Right? Okay, so now let's say someone comes in there with a pain, and you have diagnosed it through your X-rays and all, that they need they need some sort of a very fast operation. Who do you call to do that?
Well, that depends. If they have a surgeon, my first question to them would be, do you have your own surgeon? Do you have a relationship with a surgeon? And does that surgeon come to Broward Health Imperial Point? If they do, I pick up the phone and call their surgeon and tell them, I have Miss X in the ER. She has appendicitis and needs to go to the operating room. If they don't have a surgeon, I will call their primary care doctor to see if they will admit the patient, and then see who they want to use for a surgeon. If they don't have anyone, then there's a surgeon on call 24/7 at our facility who's willing to see these patients.
Oh, so it's a whole system.
There's a structured system.
That's great. So then nobody's really left out, that they're going to be taken care of.
There can't be no questions.
No.
You have to be able to.
Yeah, that is absolutely wonderful. So when you've now, how many? So I'm sure sometimes you see people who've come to the emergency room over and over and over. Now we know that some people don't have physicians, and they use this because this is the way they go. But now there is a new thing that and I think Broward Health also has it. You have small outstations. You have places where they can go, right? They're like, what do we call them? They're
urgent care centers?
Urgent care centers. So you have, because I've listened to some of that. Urgent care centers, so they don't do what you do, but for simple things, they're good, aren't they?
They are actually good, and Broward Health has some. There's a lot of different ones in the community now, and they do serve a need for less acute conditions. Plus, from an insurance standpoint, insurance companies are directing patients towards the urgent care centers by making their co-pays at urgent cares much lower than in an emergency room.
Right, but because before, we know that that's been the problem. People who don't have insurance wind up at an emergency room, and that's very hard on the financial aspects of what happens is, and I have to say, Broward Health has been one of the greatest hospitals, the Imperial Point, because you have a lot of low-income people in your area.
We do, but we have a job to care for the people of Broward County. And
yes.
That's our mission.
I know, yeah. And you do a great job with that. And of course, in the meetings I've gone to, it shows that you're trying to make that come down. And by the way, we're doing prevention, and that I'm sure when someone's there, before they leave, you give them a sheet and a list: stop smoking, eat properly, exercise, right?
And a list of clinics that they can go to, and we try to get them follow up, so they don't have to return to the emergency room. We even have social workers in the emergency department that will try to get them set up in our insurance system. if they're unfunded, there are some public programs that they can get through our social workers.
That's excellent, Dr. Carralero, because we know that a lot of these people live alone, especially if they're an elder person, and they do need someone to wrap their arms around them and say, okay, this is what we're going to do, Mrs. Brown, and if you help this. And one thing that Merlia was just here, as you know, and she has fabulous programs that I've attended, and it's called Trivia, and there's always a speaker. I don't think you've spoken there yet, have you?
I don't think so, no.
I'd love to get you to speak at one of her programs. But she has great speakers, and then they play games, and these are the people who are in the community.
Yes.
So that's how you wind up getting them enlightened, and so that they understand. And the one thing we need them to do is to tell their friends.
Right.
I actually, there's a lot of screening going on with a lot of the things. People who've been smoking, they should get a screening. A lot of things are out there, but sometimes people don't get to do those things. To make your life a lot easier.
It would, plus it'll make their life a lot better if we figure out that there's something going on.
Well,
earlier the better.
Yeah, I'm going to ask you, because I've never smoked, and I know that the first thing when I have physicians on the radio show and I ask them questions, it's first thing is stop smoking, or all right, tell us about that. So someone comes in and they're having painful, chest, and they have their cigarettes. Explain what you say to them.
Well, by the time I see them, it's a little late because they've been smoking for 30 years. I always encourage them to stop smoking, and these people know very well. Nicotine is a very hard habit to kick. Fortunately, there's a lot of medications out there. There's nicotine patches. There's not over the counter, but there's prescription medications that they can take to help them kick the habit. When you come in with chest pain and you're a smoker, I have to deal with the chest pain first. And we have to make sure that it's not your heart, that you don't have a clot in your lungs, you don't have pneumonia, or you don't have a mass in your lung. And sadly, we do find that often. People come in for unrelated things. We end up doing a chest x-ray, and you find a mass there. And then that's how we diagnose cancer sometimes.
So that's very interesting, and I'm sure that's a big surprise to them. They said, I only came in because I had a pain in my right arm, right?
Right.
And now look what's happening to me.
Yeah.
But that's not really what the ER is supposed to be doing. I mean, I don't mean supposed to be, but that's when someone goes there, they don't know that they're going to get this full workup, which is great that you do this.
We try to do complaint-appropriate workups. In other words, what you came in for, we try to do, but sometimes things happen.
Complaint appropriate
Workup, yeah. So someone's coming in with wrist pain, we should focus on the wrist. The ER is a place for emergencies. Usually we want to handle one problem at a time. Okay,
so let's this is a funny question to ask you, but a lot of people who live alone have a pet. And when they come, they bring their pet because they can't leave their pet alone, I guess. So what have you done about that? Have you ever had that happen?
We have that happen quite often. I love my pets. I have 2 pets, and I would give them body parts if I had to. But if they're a service animal, then there's no issue. But sometimes people will bring some very large dogs that are not service animals. We've had them, snap at staff. So that can, it's a very, very difficult situation. We don't want to separate anyone from their pets, but we also have to keep a safe environment.
Yes. So that's so everybody should kind of have a person that they can call, but of course they can't call if they're having an emergency.
Correct.
They just are taking care of themselves, but maybe they can give you a phone number. Yeah,
we'll figure it out.
Yeah, you will figure it out.
We'll figure it out. We try to do the best we can to take care of our patients.
So tell me a success story. I love success stories when I talk to doctors. Think of something that happened and the person walked away or rode away or something that made you so happy that you had that ability.
One of the lately we've had a lot of sad stories with all this opiate going on. We see a lot of young people dying. So in the midst of all of this, we had one lady comes to mind who came in complaining of shortness of breath one night. She had just had a baby 4 weeks ago and developed this acute onset of shortness of breath. She ended up having cardiomyopathy. Her heart just wasn't pumping well. That night in the ER, she died. We resuscitated her. We brought her back multiple times. We transfer her to our sister facility, Broward General. She went to the cardiac cath lab, and they ended up confirming the diagnosis. They had to put her in a pump to help her heart pump to get her through the next couple of days, but she ended up surviving. And she had a defibrillator, but she ended up recovering almost completely. And she's come back several times to our emergency department. I mean, this woman is a 32-year-old woman with a family and a new baby. So
good for you.
That was a good save.
That was a great save, and she actually arrested, and you were able
multiple times, yeah.
And did you? I'm sure you asked her. This was a new situation.
This happened just from the delivery. Some women develop cardiomyopathy from delivery. It's rare, but it happens.
Oh, and no one picked that up, and because she hadn't had a problem.
She didn't have a symptom. She went home and she was doing okay up until a few days ago. She developed some shortness of breath and cough. She thought she was coming down with something, and then came into the ED that night complaining of shortness of breath.
Now, had she brought her baby when she came?
No.
Thank goodness.
Thank goodness.
So,
yes. The baby was
her
at home
husband
with Dad.
or somebody. Yeah. Wow. Well, that's kind of what I said. She came in for one thing, and thought you just give her an injection of something, and found out that she really had a serious heart condition.
She did.
Well, good for you. Well, that was a great story, because that's I have to assume that. So when people bring their babies in, now I'm sure that this is a emergency room for all ages. You said that.
All ages.
So what happens when crying babies come in? That must be hard to figure out what's wrong with them. Is it? Because they can't tell you.
Generally, the good news with babies is most of them are not sick. They're very healthy little creatures. So most of it is cough, cold, congestion, minor things. It's rare that you see a sick child.
So I see. So it's just all right now.
Taking care of their fever.
Okay.
Taking care of their fever. Yeah.
Right. Well, let me just tell everybody again. You've been listening to Dr. CESAR Carralero, and he is the director of the emergency medicine system over there at Broward Health, Imperial Point. We certainly I learned a lot. I'm sure our listeners did too. And thank you so much.
Thank you for having me.